Hi, welcome to Cardiac MRI Simplified at mricardiac.com. Today's topic is not MR, it is myocardial fibroblast activation imaging with FAPI-PET. So, this is a 59-year-old diagnosed to have mucinous adenocarcinoma of the sigmoid colon, and he came for a FAPI-PET. And in the heart, we saw these areas of abnormal uptake with thinning of the myocardium in the apical segments, a little bit of, in fact, a remodeling along the septum. But this orange uptake is along the LAD territory. And so it tells us that there is fibrosis within or scar within the myocardium. Um, this was not picked up at the time. This was almost a year and a half ago. But 2 weeks ago, we pulled out all our FAPI-PET scans and looked at their hearts. And thanks to Dr. Pooja Bharti, Pooja works with us. She's the head of our nuclear medicine or PET-CT center, and the rest of the team for taking the effort, pulling out the images and identifying patients who had FAPI uptake in the heart. And this was all triggered by this article in JACC that talked about looking at fibroblast activation after acute MI. And this is an image from their article. They used PET MR for this and correlated the FAPI PETs with late GAD enhancement. And they concluded that intense fibroblast activation peaks early after acute infarction and extends beyond the infarct zone. This remains high even after 3 months, but chronic activity is observed for several years after the acute event. And then, of course, there's some, remodeling stuff, etc. But the point is, if you see uptake in the myocardium, that means that there is scar or fibrosis. And this was an undiagnosed LAD territory infarct that must have occurred at some time, but the patient is not alive now, and we have no way of figuring out anything. So, this is not true of FDG PET CT, because with FDG PET, and this is a patient of CA breast, and you can see diffuse uptake in the myocardium. If the patient is not prepared for an FDG cardiac PET, you will get enhancement all over the place and uptake all over the place. And that doesn't mean anything. It is only when you prepare the heart specifically, as in this patient with cardiac sarcoid, where we did MR and PET on the same day, that we can comment upon these areas of activity to say that they imply inflammation. So, any FAP uptake in the heart is significant and implies fibrosis and scar formation, whether due to infarction or whether due to non-ischemic etiology. So FAP, as you've now figured out, is fibroblast activation protein. FAPI is fibroblast activation protein inhibitor. Imaging, so we do it with gallium. There are various ways of tagging FAPI, and it's an excellent way of looking at many kinds of malignancy. So here's a 78-year-old with CA bladder and liver mets who had a FAPI PET, and you can see there are abnormal areas of uptake with increased thickness of the myocardium, and this shows an apical plus septum predominant HCM phenotype with scar and fibrosis. But again, this was never worked up and the patient did not survive. So, what does all of this mean currently? We know that more and more FAPI PETs are being done for a bunch of specific malignancies like hepatobiliary, liver, signet cell, mucinous adenocarcinomas, etc. If FAP uptake is seen in the myocardium, it is abnormal and should be reported. Now, the nuclear medicine guys need to report this so that the referring doctors understand that there is scar or fibrosis or something abnormal within the myocardium, unlike with FDG PETs where we don't report the uptake within the myocardium. So, when there is scar and fibrosis, then the patient should be tested further for the exact etiology, ischemic or not, if not already a known case of cardiac disease. So currently, a lot of this is just proof of concept, small studies. This was the first major clinical trial that I showed earlier that came up in JAC a month ago. But it is possible, given that uh, FAPI-PET can visualize scar and fibrosis, that we may use it as one of our primary tools for evaluating infarcts, or maybe combined with late GAD MR. I'm not sure, but uh, there will be a role within some of the algorithms. And today's post is really to kind of bring this into our consciousness. I wasn't aware of this till I read this article, and I try and keep abreast of most of this literature, but it just completely flew by me. And I thought it would be nice to share with you that whoever and whenever anyone's reading FAPI-PETs, we should be cognizant of the fact that any uptake in the myocardium is abnormal, should be reported, and should be worked up. That's my WhatsApp channel. That's the book that started it all. That's my Atmaswasth book. And I hope I've given you some food for thought. And, I'll see you next month.